All right.
Miss Amy.
Good morning. Nice to see you again, for those of you that I met on Friday. So on Friday we were talking a little bit about, or I was asking you what things you might be interested in learning about, seeing as how I was going to be lecturing here today. And the idea came up about kind of kids with behavior and discipline problems, that sort of thing. And so that's what I'm going to talk to you about today. Specifically, we're going to talk about a diagnosis called oppositional defiant disorder. And it's often referred to as ODD, an acronym for the first letters of those words. So, if we're going to talk about this, we need to understand exactly what it is. And the DSM is the Diagnostic and Statistical Manual, and it's what we use in the field of psychology and also in the field of psychiatry to diagnose mental health conditions or disorders. And so there's a group of disorders called disruptive impulse control and conduct disorders, kind of like a heading or an umbrella. Under this, we have oppositional defiant disorder, which is what we're going to be talking about today, intermittent explosive disorder, conduct disorder, antisocial personality disorder, pyromania, kleptomania, and others. Okay, others specific, others unspecified.
Amy, I'm going to interrupt. Does everyone know what a disorder is? Yes? A disorder, everyone knows what this is? No, Afaf doesn't. Can you explain what disorder is quickly?
Yeah, absolutely.
I think we should move forward.
I think that's great. So, you can explain it? Oh, great.
Yeah. I think it's a deficiency in some character of mental, it seems like some character of mental disease or something. If you have shortage in something, called disorder, like anxiety disorder.
So there's symptoms, right?
Mm-hmm.
Yeah.
Very good.
So it's something that, an example of a symptom Amy will explain.
Yes, we're actually going to go over the specific symptoms for oppositional defiant disorder, but to just give you an example that makes sense. So if we think about it sort of more medically or physically, if you had a cold, like a cold and you were sick, a symptom would be a stuffy nose. Okay, does that make sense? All right. So, if we're talking about this disorder, oppositional defiant disorder, we're going to talk about the symptoms and how we diagnose it. So, it's a pattern of angry or irritable mood, argumentative or defiant behavior, or vindictiveness. So, that's a word maybe let's talk about for just a moment. Vindictiveness is a negative connotation. This is bad. This would be something more extreme than being angry or argumentative. Vindictive is a person who kind of wants to get back at you. Okay? And lasting for at least 6 months as evidenced by 4 symptoms. So 2 things are important here. The duration, so at least 6 months. This isn't somebody has a bad day one day and we're going to say that they have oppositional defiant disorder. And they need to have 4 symptoms from these categories. Okay? And we need to see this interaction of the person that we're saying has oppositional defiant disorder. We need to see these behaviors with someone who's not their sibling. Because, sometimes kids will fight with their brothers and sisters, right? And we kind of consider that to be a normal part of development. This is something more extreme than that. Okay? Does that make sense? All right. So the first symptom, angry or irritable mood. We're okay with angry, right? Are we okay with the word irritable? Okay. So this means the person is often losing their temper, they're touchy or easily annoyed, they're angry and resentful. Do we feel comfortable understanding these symptoms? Another symptom would be argumentative and defiant behavior. So argumentative, just meaning someone who likes to argue, okay? Defiant is someone who's always going against what the rules are. They're not following the rules. So they're arguing with authority figures. Authority figure could be their parents, grandparents, anyone who's taking care of them, teachers. They're actively defying or refusing to comply with requests from authority figures or rules. So that's that part about breaking the rules. Deliberately annoying others. So if we think about the word annoy, right? Sometimes we might annoy somebody accidentally because we're tapping our pencil and someone else finds it annoying, right? Or that's not what we're talking about. We're talking about if you know that constantly poking someone is going to annoy them and you're doing it on purpose, okay? You can kind of picture kids doing that sometimes. And blaming others for his or her mistakes or behavior. So if they're in the classroom and they're being, called on by the teacher for some sort of disruptive behavior or breaking the rules, oh, it's not my fault, the student next to me is making me do it, or it's your fault, teacher, because whatever. They're not taking responsibility. Is that kind of, okay, great. Vindictiveness. So this is spiteful or vindictive. And these are kind of, not typical words that we hear a lot. So spiteful or vindictive would mean that they kind of, that idea of wanting to get back at somebody for doing them wrong, they're holding on to that angry emotion and they want to retaliate. They want to, if somebody has done them wrong, they want to do wrong to that person back. Okay?
Revenge,
like revenge. Perfect. That's a great word to clarify that. Okay? And so then we have to think about a couple of other considerations if we are going to be using the term oppositional defiant disorder to describe how a child is functioning, as opposed to, okay, it's just a child who is maybe having a bad day, a little bit of bad behavior. So this behavior is associated with distress in the individual or others. So what that means is it's causing disruption to other people around the child, to the child's family, schoolmates, teachers, and it's also distressing or disruptive for the child, meaning they're not able to do in school what they should be doing, or at home they're constantly being punished and so they're not able to play or do the things that they would normally want to do at home. And it's impacting negatively social, educational, occupational, or other important areas. Does that make sense? What those areas are? Okay. Another thing that we have to sort of rule out or think about if we're going to diagnose somebody with this disorder is that the behaviors aren't happening just in a course of a psychotic episode. So to make that clear, somebody who is suffering a psychotic break or a psychotic episode is not in reality. Their behavior is out of the realm of the normal, and they're going to require some significant psychiatric care, okay? Substance use. So obviously, we know that if people are using drugs or even under the influence of alcohol, they may display behaviors that aren't typical of them. And if that was the only time that they were displaying the above behaviors and symptoms we talked about, we wouldn't give them this diagnosis. If they are depressed, which we talked a little bit about a diagnosis of depression last week, or if they have bipolar disorder, which is another disorder that comes in the same kind of family as depression. It's a mood disorder. That's all you kind of need to know about that right now. Also, we can only give this diagnosis if the person that we're talking about doesn't meet criteria for another diagnosis, which is called disruptive mood dysregulation disorder, okay? And then if we're going to diagnose a child as oppositional defiant disorder as having that, we're going to say whether it's mild, moderate, or severe, okay? So that's a lot of information that I've just given you in trying to kind of explain what this disorder is and to answer some of the questions that we had last week about children and their behavior, particularly when it's bad behavior. Do you have any questions on anything that I've talked to you about so far?
Yeah, what does mean pyromania?
Sure, that's a good one. Let's go back to it so we can break it down. So this word, pyro, so if we look at the word pyromania. Okay? If we look at this part of the word, just like we did last week when we talked about the word illuminate and we circled that loom part because it means something, anytime you see this, it's referring to fire. So another word in English that you might hear is pyrotechnics, and that would have to do with like special effects that involve fire. Okay? So pyro, and I don't want to give you wrong information. So pyro, I'm not sure if it's a Latin or like a Latin root or a Greek root, but in any event, pyro always means fire. So pyromania would be somebody who likes to set fire to things.
Pyro is Greek.
Okay, and mania has a specific meaning as well. Mania.
Yeah, when we see, can you think of a way to, if we,
Applications of something, maybe?
because it's not always going to mean
What's the question?
mania. So if we see that at the end,
Mania.
tendency to, or liking. Let's look it up.
Let's look it up, just to make sure. It's an abnormal elevation of arousal. Your arousal is elevated. Whatever it is that you are aroused by, it's elevated. Does that make sense to everybody? It's high. Arousal is your internal feeling about something is increased.
We can think about words like desire or urge, or so pyromania, an urge to set fire or a desire to set fire. So along those same lines, let's talk about another word that appears on this list. Yeah. I'm just looking up the Latin as to, or the origin as to whether that is Greek or Latin. Can you look that up, Deborah? Mine's being super slow.
Greek.
Okay.
Thief.
So we have another Greek root here, meaning thief. What does a thief do? Exactly. So someone who's someone with kleptomania has an urge to steal things.
This is kind of a symptom of that disease.
This is another specific disorder in the same category of disorders as oppositional defiant disorder.
So all these symptoms is gonna like in one.
Well, how we would see the symptoms. So, just to summarize, these are categories of disorders under this heading or main topic. Okay, and then everything under diagnostic criteria are the specific symptoms for oppositional defiant disorder.
So not all the symptoms is gonna.
Right, we're not going to see every single one in every single child with this diagnosis, but in order to get the diagnosis, we're going to see at least 4 of them.
What does this DSM stand for?
The DSM is a book.
This is an important book. If you're interested in psychology or medicine.
So, DSM stands for the diagnostic, D, and statistical, S, manual, okay? And the 5 refers to the fact that the book's in its 5th revision or edition. Great question.
Can you talk about how we use the book a little bit?
Yeah. So we talk about the book, or we use the book in order to codify or manualize, which are words that sort of mean that everybody's doing the same thing or following the same criteria. In English, we have an expression, everyone's on the same page, right? So that's what that would mean. And in this way, as a practitioner, as a psychologist, if I get a patient that has a diagnosis of oppositional defiant disorder, I know exactly whatever doctor they're coming from, how they arrived at that diagnosis. So it's no one's opinion, right? It's not like you can...
Everybody should stick to it.
Exactly, and it makes it more factual, you know? So if you were going to see someone and they couldn't just say, oh, I feel like maybe they seem depressed, you know? You're diagnosed with depression. You have to pay attention and go through the symptoms and give that diagnosis, just like you do for medical conditions, right?
For the lab manual, we have a lab manual.
Right. And so manual, right, is a kind of book that helps us, it's the rules or instructions and standards to understand things, so great. In the interest of time, I'm going to skip over this. And we're just going to talk about I'm going to try and answer for you some questions about oppositional defiant disorder. So the first one would be, how common is it? Okay? And again, we're talking about, due to sort of the interest areas that came up last Friday when I was asking you, this is a disorder that we see children have. It's a diagnosis typically given in children, okay? So this is going beyond bad behavior. This is when bad behavior becomes a diagnosis, becomes a disorder. And in the United States, we see about 200,000 kids being diagnosed with oppositional defiant disorder.
That's per year?
So I'm going to make sure that's...
Or is that at any one time?
I think that's at any one time, but... check my note on that. Per year, cases per year. So I don't know if that's diagnosis per year or anyone in one per year that has the diagnosis. That's a lot. Symptoms generally are going to begin before a child is 8 years old. That doesn't mean they have to be diagnosed before 8, but if I were diagnosing a child or a psychiatrist or a medical doctor, we would be talking to the parents and say, when did you first notice some of this? And we would expect that they had seen these behaviors for a long time. What causes oppositional defiant disorder? Not just one thing. So if we're talking again about a medical condition like having a cold, that's caused by germs, right? We know that. When we're talking about this disorder, it's kind of a combination of factors that we often refer to as bio, psycho, social. So bio coming from the word biology, and I know we have some biology scholars in here. So coming from within you, right, your biology. Psycho, from psychological, mind, right? And social, the way that you're raised, the school environment, your home environment, all those sort of things. So the causes are kind of a combination of these things. Maybe there's a genetic predisposition, and maybe the way that you psychologically handle things combined with how you're being raised or your school environment is causing an expression of these symptoms. Okay, so more complicated than something like a cold, right? Can oppositional defiant disorder occur with other conditions? Yes. We commonly see it occurring with another common childhood disorder, which is ADD, okay? Attention disorder, right? Or ADHD, attention hyperactivity disorder. Are you guys familiar with those terms? Okay. Can it be prevented? It's an interesting question. So, if the child is young and these signs and symptoms begin to emerge, there are different ways that you can address the behavior at home, parenting style wise, and at school to help the child learn some regulation and to learn about rules and controlling some of their behavior. So where it's not as easy as preventing, say, again, we'll just use the example we've been using, a cold, right? You can hope to prevent a cold by washing your hands, not coming into contact with someone who has the cold, etc. There are things that can be done to maybe make it less likely that the child would get this diagnosis. And how is oppositional defiant disorder treated? Well, again, it's not something that you can sort of just quickly take a pill for as if it were a medical thing like, but there are, if there's the concurrent attention disorder, then there are medications available for that, which may help the child to regulate themselves. And it's just treated with behavioral programs that can be done at home and at school.
So parents participate in that, right?
Absolutely, yeah. And there's a lot of research on this, and there's different programs out there. That's a bit beyond the scope of this talk, because we're just sort of learning about what this disorder is. But there are definitely programs out there that have been proven in the research effective. Yeah. So I hope that this answers your question a little bit about what we were talking about in terms of children when this sort of, a bad behavior that a kid's expressing or showing kind of cross the line and become something even more. Do you have any questions? Deborah, is there anything further that you think would be helpful?
I think you did a very good job of explaining it.
Okay.
Thank you.
Sure. Of course. All right. Thank you.